Hello everybody, this meeting is being live streamed on our YouTube channel. The evacuation procedure. A fire drill is not expected, so if the alarm sounds, please evacuate the building quickly and calmly. Please use the stairs and do not use the lift. Once out of the building, please gather outside Lloyd's Bank on the opposite side of the road. Exit by the door by which you entered the room or by the fire exits, which are clearly indicated by the standard green fire exit signs. If you need any assistance in evacuating the building, please make yourself known to a member of staff. The meeting is being live streamed on YouTube. It will be available to view later via the council's website. Please can I ask that you turn your mobile phone off or silent during the duration of the meeting. Welcome everybody to the meeting. I'm chairing for the start and then Councillor Evans will be taking over. We've had apologies from Councillor Beetham and Councillor Harbison. Are there any other apologies? No, brilliant. Has everybody had time to approve the minutes? Have we all looked and are we all happy? Firster? Thank you. Can we get a seconder? Brilliant. Thank you, Councillor Cooper. Are there any declarations that any members need to declare other than what is in the minutes, in the paperwork? No? Brilliant. So we have some speakers in today and we have some Teams items, and we also have Mr. Smith here to talk on items 7, 8, 9, 10 and 11. Item 6 are questions to Cabinet. Is there anybody who has any questions for the Cabinet member in attendance? Councillor Golby? No? Councillor Golby, is there anything you want to say? No? Okay, that's great, thank you. So item 7 is the Health Watch, and we have a presentation from Carla Seal, who's the Outreach and Engagement Officer at Health Watch.
Hi, good evening, everyone. Thank you very much for asking me here this evening. It's just a very short presentation that you'll find from page 15 here. Really, the purpose of me being here this evening is just to remind anybody who doesn't already know about Health Watch and what we're about, just to kind of refresh people on what we are doing and what we're currently looking at, and the projects and scope of work that we're looking at in the next few coming months. Also, really, it's to introduce myself because I am the North Warwickshire Engagement Officer. So I'm trying to get out and about into the community as much as possible. So it would be great if any of you know of any groups in particular that you feel aren't having their voices heard at the moment. Please feel free to contact me or invite me along to any groups or open events, anything like that. I'm very much trying to get out and about as much as possible to gather views from the residents, particularly in Nuneaton and Bedworth. So on page 16 it's kind of the overview of the local Health Watch is what we're about. So obviously Health Watch England is the sort of our main parent organisation, and then there's over 150 Health Watches, the statutory organisations that everyone must have. So we're basically there to try and help improve services and also to just have sort of an impartial view on what's coming into us from all across the various health and care services. We're trying to get to hear from the people that aren't always heard from, and that's definitely something moving forward that I'm trying to make an impact in this particular area in North Warwickshire. So we've got a little triangle within this page as well to sort of show the different elements of what Local Health Watch does as well. So my role being engagement and outreach, very much on the ground, going out into community services, getting into the hospitals, getting into the primary care networks, etc., getting into the patient participation groups, church groups, faith groups, whatever it may be. We also offer a helpline and we have a website. If anyone wants to look at our kind of statistical information and sort of the facts and figure of what Health Watch Warwickshire did, we've got our annual report that is on our website at the moment, so please feel free. We put all our information onto the website with all those particular data sets. So the kind of our approach is all about, it's what we are hearing from people. We're not putting any of our thoughts or emotions. There's no politics going into anything. We are just capturing the feedback from the people that we're speaking to. So, for instance, last week I was in Nuneaton and Bedworth libraries and just going in and speaking to whoever would talk to me, and I capture that and report on it. And then we look to see if there's any kind of service improvements that can be made. If we're hearing specific information about particular places, we can look to do a deeper dive and to do a bigger piece of work on it. I'll talk about a couple of those in another couple of slides that we're looking at the moment. It's not about catching anybody out. That's the kind of the key thing. We're not there to try and play any games with anything. It is all about trying to get services improved for the people of Warwickshire in a nutshell. We're looking at our emergent priorities that are coming up. So any priorities that we come up with have all come from people from Warwickshire. So for instance, if we go out and we're hearing about a particular issue, we will then sort of develop upon that and see what can we do to add value. What can we do about that particular thing? Are we overlapping with any other services? And we'll make sure that our resources are used properly in that way. One of the key things for us is building relationships, not just with community groups and the people that we're speaking to, but across the board with everybody, all our partnerships, or the people that we're working with on a day-to-day basis. And that takes time. I'm definitely finding, I've been in this post for about 5 months now, and I am really trying my hardest to get embedded within the North Warwickshire sort of community groups and so on, but I'm aware that there are many that I'm not aware of, and so that's where I would ask for the councillors to point me in the right direction, please. I by no means I don't know everything about the area at all. So our emerging priorities at the moment, to move on to page 19, we've got the list of all our staff before that, but I'm sure you don't want me to go through that. At the moment, the things that are coming up, we've got cost of living, we've got a survey that's out at the moment that sort of looks at the impact of cost of living, because we were getting a lot of anecdotal information back from people about not being able to afford prescriptions. We were also getting information about people maybe not using their hospital appointments because they couldn't afford to get to the hospital, couldn't afford taxis, etc., things like that. So we've currently got a survey out that we've called 3 Quick Questions. I'm pretty sure I did email all the councillors with these. Please check your junk mail. That was a while ago now. It was back in December. But I do think sometimes I end up in people's junk mail. Unfortunately, please take me out of there. I will send it around again, however, just so you can have a look at it. And if you've got any particular people that you would like me to come to groups and do this survey with, I'll more than happily do that. So we've recently done a survey on dentistry. That report will be out soon. We covered the whole of Warwickshire with that. We called every dentist in Warwickshire to see about their NHS services. So we've got the findings of that coming out now. And we are beginning to sort of look at work with mental health in young people as well. So we are responding to things that are coming through to us in that respect. Just on the final page here, it's just all about page 20. It is just kind of our key tenets, the sort of basis that we're working from every day, is just really trying to open up that communication, get the trust of the local community, and always remembering the kindness of one person is often the thing that can make the biggest difference to people within health and social care as well. So yes, thank you very much, and any questions from anybody?
Carla, thank you very much, and I apologise to the committee for being late. Thank you, Councillor Shires, for stepping in. I think Mr. Smith is down to speak on this item. This is the Health Watch item, Mr. Smith, if you want to speak. Oh, sorry, Carla, could you just turn your microphone off? It's a very silly system. There we go.
Another report that has very little information on where we're at the moment. An industry that has a lot of finance, basically left the most vulnerable people in society to fend for themselves for the past 3 years. Although it would be
Mr.
apparent...
Smith, sorry to interrupt. I think you're speaking on the wrong item. This is a charity. It's not funded by the government.
Yeah, but
this is a charity.
As a charity, yeah, they've set out a list of things they're going to do, yeah?
Right.
That you're going to supposedly help them. Yeah, it's supposed to be a report on the mental health in Warwickshire, right?
No, you're speaking on the wrong thing, Mr. Smith.
It's just a charity, yeah?
It's a charity
I think
that...
you wasted your time anyway. You're in the wrong place. You should be possibly out in the streets talking to people that have been deserted by the agencies that you're going to address. The mental health agencies have sadly, over the past 3 years, if they didn't see what was coming, yeah, they shouldn't really be in the industry. The actions taken by the government, yeah, the actions taken by the government, yeah, would going to cause the storm that we're in now, yeah? We have a rate of suicides that's horrendous, yeah? People have been pharmaceutical drug addiction that's running rampant, and now they can't get drugs, yeah? This is what I'm being told on the street, yeah? These are the problems that Warwickshire mental health services face, and I hope you can help them sort them out, love, I really do, yeah? Because along with all the other health storms that are coming, we have a death rate that is 10-20% over the average for this time of year, yeah? Even above the supposed pandemic, yeah? Which is going to cause, that means so many more people grieving, it's going to cause a storm, yeah? What we really need is people on the ground, yeah? Not online. Online hasn't worked. This council tries to do everything online, yeah? Because it doesn't like facing the public, yeah? So I really hope you can help. I really, really do. But I feel you're addressing the wrong people here. Okay. Yeah.
Carla, I'm more than happy if you want to respond to that.
Thank you very much for your points. I think they're really valid and important, so thank you for that. And I literally do. That is my job. I go out and I speak to people, and that is what it's all about. So, you know, and we do find that we get, and we share it amongst everybody that we work with as well. So, yeah, I think it's important that to recognise as well, your point on people maybe not wanting to do things online. There's actually been some studies that have shown an uptake in people receiving care online because they prefer it with the mental health sometimes. So it's one of those things that you can, you know, some people prefer it, some people don't. But it is, as you said, very important we get out and actually speak to people. So I really take that point. Thank you.
Last 3 years when everybody
Yeah, and it will be something that continues, I imagine. But yeah, thank you for that.
Thank you, Carla.
Thank
you so much. And I have to say, I think it's important that those patients who want face-to-face provision get it. But, you know, I don't think that we should ignore the benefits of virtual healthcare. I myself, when I had an issue, I have a facial condition, everyone knows about it. I find it easier to see my GP over Microsoft Teams. It's just easier for them, it's easier for me, and do it from work. So I don't think we should always ignore the benefits of that. Does anyone... yes, Councillor Cape.
Hi there. Thanks for your input. I did hear you say that you do go round and about speaking to people, which was great. I have got a question on your slide on page 16. I'm not trying to catch you out. It is interest. It says to seek the views of those who are not always heard and reduce the barriers that they face. Throughout the presentation, I didn't see anything about the Armed Forces Covenant. That's an interest of mine, the mental health and health, indeed, of Army veterans, Navy veterans, Air Force veterans. It's now enshrined in law, and I just wondered what, if anything, Health Watch are doing to actually gain information from that group of people. There are a lot of rough sleepers who are ex-military, and I just wondered what you're doing on that front.
Thank you for that. That is something, basically we're trying to look at health inequalities as well, which this would definitely come under. We did a project last year which was called the RAP project that I don't know if you're familiar with at all, but that was working with the homeless agencies in particular to make sure that people get healthcare access, which there probably may have been a crossover potentially with people that you're referring to. I don't know of any particular projects. I've only been in post for a few months, so I'm not specifically aware of anybody that's done a piece of work, but certainly, I mean, I've got a list of groups that I'm trying to contact, emailing out, to try and see if I can get an in to go and speak to them, or how I go about communicating with these particular groups. As far as these kind of, you know, the groups that are often forgotten about, that maybe are forgotten to be asked about certain things, we are really conscious of making a big effort to get into those groups at the moment. My colleague's just been doing a project with deaf people. We've been going to all the Warwickshire Vision sites, but there's always another group of people that we need to get to. So if you've got links with that, that would be absolutely fantastic. I'd love to go and visit people, or get to speak to a group. So thank you for that. Thank you.
Thank you. I wanted to ask a question about dentistry provision. And we've all heard stories anecdotally of residents struggling to register with new dentistry providers. I just wondered, from the perspective of Health Watch, I mean, what is the issue, and how do we overcome the issue?
Again, this has been our huge survey that we've just done. We got a really good amount of people responding back through Warwickshire. Unfortunately, North Warwickshire is sometimes more difficult to crack with getting respondents with surveys and so on. Looking when we called the dentists and we went round everyone, there is more NHS provision within this area than there is, say, in the south of Warwickshire. That much was plain to see when we were ringing round all the dentists. But that is a report. All the data is being pulled together at the moment. But we do get people ringing and asking where there is provision and where there is NHS provision at the moment, and we can find that out for people. So we kind of try and do that signposting as well. The question of dentistry, it is something Health Watch England did, so every area has done a dentistry survey near enough. Warwickshire itself wasn't seen as being one of the areas that had a chronic issue. So as we look at the country, we're not actually somewhere that has got a particularly a bad issue with dentistry, if it puts it into perspective a little bit. But our report will be out, so our first kind of papers will be out on that soon. So if you keep an eye on our websites, they'll be published as well. So.
Yes, it'd be good to know a bit more about what the issues are beneath that. Are there any other questions for Carla? I don't see any indication. Well, look, on behalf of the council, thank you very much for attending. It's always a pleasure to welcome Health Watch, and wherever we can support the organisation locally, we are more than happy to do so. So thank you very much for attending. You're more than welcome to stay, but you might not be interested in other parts of the agenda. Thank you. So we now go on to item number 8, which is a presentation on general practice overview primary care across Nuneaton and Bedworth. And we have Rose with us from the NHS, who's joining us virtually. Rose, can you hear us okay?
I can. It's my colleagues that will be leading the
Ah,
presentation.
well,
So
even better. Who do we have? So we've got. Why don't you introduce yourselves?
So I'm Alison Cartwright. I'm the Chief Delivery Officer with a responsibility for primary care in the ICB, and I'm joined by Dr. Qureshi, who I'll let introduce herself.
Brilliant.
Good evening, everyone. I'm Dr.
Hello.
Qureshi. I'm one of the GPs in Coleshill area of Warwickshire North, and I'm a PCN Clinical Director. Nice to see you all.
Thank you, and welcome to the meeting virtually. Well, it'd be great to hear from you. Thank you.
So I'll start if that's okay. I'm going to share the slides on screen as well. I know that you've got a copy there, or there's just one additional slide, so I hope that's okay if I share them on screen. So we'll just, hopefully that has come up or is in the middle of coming up. Right, so this presentation is about the provision of general practice in Nuneaton and Bedworth. And you've seen this has been shared with the meeting paper, so you've had access to this data. The first slide, I won't dwell on it, just tells you the practices that have been included in this data. So I'll move on to the third slide, which shows the number of appointments now compared to the pre-pandemic. And I think the things to pick up here are that practices in Nuneaton and Bedworth delivered nearly 54,000 appointments in November 22, which is the latest data we've got. So that's on average about just under 2,500 appointments per working day in November. So you can see the large number of appointments that are ongoing. And that's similar for all months. It's not that November stood out specifically. What we can see that compared to pre-pandemic and November 19, that's we've seen a nearly 14% rise in GP appointments and patient demand for GP appointments over that time period. You can see on the slide the shift from face-to-face appointments and non-face-to-face appointments that we instigated throughout COVID. And you've already mentioned earlier about that it is useful for some patient cohorts to actually access their GPs on either online, on Teams, by the telephone, etc. And we're seeing that reduction of 25% is akin to the same reductions that we see in our acute trusts on follow-ups. So that's a national approach to how we manage our capacity. Appointment volumes, you can see here that in Nuneaton and Bedworth, the number of GP face-to-face appointments per 1,000 population is above both the Coventry and Warwickshire, Midlands and England numbers overall. So you can see that there is a large number of appointments being delivered. That's GP appointments. Other appointments, so for example, nurses, physiotherapists, is slightly lower for Nuneaton and Bedworth, but we're working on improving the recruitment to those areas. From a waiting times point of view, nearly 73% of patients who call and need a GP appointment are seen within the same day or the day after, which is above the national target. Telephone appointments are slightly higher than that at 79.7%. And you can see that in comparison, where Nuneaton and Bedworth are the highest, again, compared to the whole of Warwickshire North, the whole of Coventry and Warwickshire, the Midlands and the national level. So performing well on that. This is the extra slide that we've put in, which we will share with you and share after the meeting. In addition to individual GP practice appointments, which is the data that I've just shared, we also have additional, over winter, we've put on additional capacity. So we've got our PCNs have delivered extended access. So that's where we've increased the appointments available to cover Monday to Friday up till 8 p.m. And also Saturday 9 till 5 p.m. So that's an increase of 30 to 50% in December. And also we've included, increased that by 10% for January to March, and those appointments are bookable by 111 and also the GP practices. So that's additional capacity over and above what the practices have previously delivered. We've also put in place acute respiratory hubs. So in December we started that with paediatric hubs, assessment hubs, and that was to respond to the surging capacity that we got with strep A. I think that's, I don't know if it's strep A or B, but it's one of them. Maybe she's nodding at me, so it's strep A. So in response to that surge that was seen at the time, and since January, we've now opened that up to, it's all age, so adults and paediatrics, and they're open from 4 till 8 on a Monday to Friday and 9 till 5 on a Sunday. Bearing in mind on Saturday, we've got the additional sessions that I've mentioned above there. We've also got primary care surge capacity, which is a service that we have in place to support practices that are either seeing a sudden increase in demand for appointments, but also those practices that have the greatest need or immediate workforce issues that day with either staff going off sick, etc., that the surge capacity is available. Patient experience. So you can see here that the patient survey data does show that there's been an overall reduction since 2021. So this is an annual survey that's taken place earlier in 2022, and we have seen a reduction in response to the question of how easy is it to get through to your GP appointment, and that has dropped. And to respond to that, we've got a plan to increase our, to change our I can never say this word, telephony systems to improve that, so that patients' appointments can stack and they don't drop the calls. So we absolutely acknowledge that there are some areas that we need to improve. Equally, this data that I'm showing you is for Nuneaton and Bedworth overall, and we also monitor this activity at practice level. And again, we're aware that some practices we are working with to support them to increase those areas that need improvement. Oops, sorry, shot forward. So that's patient experience. Pleased to note that when patients that do get through the overall experience of GP practices dropped less than the national picture as well. That's more on the patient survey. General practice workforce, this data shows that the number of GPs per 1,000 population, so that Nuneaton and Bedworth has similar to Coventry and Warwickshire, but is above the national average, which is really good news given the difficulty that we have in recruiting and retaining GPs, so that's really good news. We do in Nuneaton and Bedworth have lower numbers of nurses and the additional roles like pharmacists, paramedics and physiotherapists, but again we're working very hard on that and looking at different employment models to support recruitment and retention of those groups of workforce. And then finally, the CQC obviously assess GP practices, and this is the current position where you can see that we have 2 practices that requires improvement, and all the rest are retaining their a good overall on that assessment. In addition to that, we obviously have work programmes on recruitment and retention and workforce, and how we work on increasing that primary care workforce. And we also have an estates programme that looks at primary care estates, and we've currently got ongoing a primary care, look into the future really, about primary care estates and how that becomes fit for the future, and what the needs are of each of the PCNs for how we're changing delivery of primary care and what the future estates needs are. That was the end of the presentation. Are there any questions or anything you want to add, Maywish, actually?
Thank you very much for that. Councillor Evans has just had to pop out. We do have... Oh, sorry. Was there somebody else trying to speak? Or was it
Sorry.
that for the presentation?
No, sorry, I was just handing whether Maywish wanted to add anything to the
Oh, on
presentation.
your particular part?
Yeah.
No, nothing for that so far. Will we do it at the end? Thank you. Sorry, was that the end of the presentation?
No, sorry,
No.
that's what I was saying. That is there anything that Maywish wants to add to the presentation as a GP in Nuneaton and Bedworth? I was just handing over to her.
Oh,
for
right, okay.
Anything she
Yeah.
has to add? Maywish.
Yeah, I was just going to say, I mean, thank you for that, Ali, and I think you've covered most of the important points. I think we all recognise that we're working in an overstretched system, but our answer to the challenges are to work together as a team with all the other partners to do the best we can in the situations. And as you've just heard Ali highlighting some of the key areas of improvement, where we're working very closely together with ICB and wider organisations to actually improve the patient experience, access, communication, etc. So we welcome any questions from any of you.
Thank you very much for your presentation. Just a few from me. I wondered if you could tell me, do GP surgeries locally use the same telephone system? Am I right in saying that there is a proposal to basically to get all of them using the same system so that all provide the same level of data?
Yes, that's right. So they don't currently all use the same telephone system, but that was in the presentation I mentioned that action plan to look at the telephony, the telephone system, that's easier to say, to look at the telephone system so that we move to a cloud-based telephone system, which allows easier access to the data, but also allows things like call queuing. You know, when you ring up and you say you're third in the queue, rather than it just ringing out or ringing engaged, etc. So yes, we do have a plan that all practices will be on the same system.
Brilliant. So does Coventry and Warwickshire currently hold telephone waiting times by surgery? Do you hold that data at all?
No. Telephone waiting times or patient appointment waiting times?
Telephone waiting times.
No, we don't.
Is that would other trusts, other NHS trusts hold that data as well? Or is that just Coventry and Warwickshire?
No. Depending on the system, then it's the potential for the practices, individual practices, to understand that, but no ICBs have that data at practice level.
Okay. And the other thing I just wanted to ask as well is, you might not be able to answer this tonight, but if you could get back to us, do you hold data on the number of complaints or referrals rather, that you get each year to the PHSO, the Parliamentary and Health Service Ombudsman?
Yes, I'm sure we will have that data
within
our complaints team.
Would you be able to provide, I don't know if it would be Nuneaton, Bedworth or North Warwickshire, would you be able to provide that data to the committee?
I will need to take that back internally and check.
If you could get back to us on that.
I don't personally have access to that,
but
I'm sure that we will.
That's fine. Any member? I'll come to it at the end. Councillor Cape.
It's one from our own education, really, on the graphs, because we see Nuneaton and Bedworth, North Warks, then Coventry and Warks. Is there a reason why we don't get South Warwickshire? So there's a comparison between the North and the South. Why is Warwickshire rolled into Coventry? There might be a good reason for that. I'm just asking.
So we do have that data. It was just when you're producing a graph, what we can compare, you know, the number of things that you can compare to, you end up with a very large graph, but we do have that data. That's why we try and put Coventry and Warwickshire in as a whole, so that you get, because obviously that's what we compare areas to, is our whole system, because what we want to make sure is that as across the whole system that we're providing equitable service.
Yeah, I understand that. It's just as I did actually take time to read through the data, I was looking, and the question that came into my head was, okay, that's interesting, but how do we compare to the south? And I would have liked to have known that.
And does that include, obviously, so we have 4 places, well, 3 in Warwickshire. So I presume you mean Rugby as well as South Warwickshire, or just you're only interested in South Warwickshire?
That shows my lack of education. It was that contrast that I just wanted to
It's
see.
the contrast of all
to
the
see if there's a
places.
variance between the north and south of the county,
Yeah.
effectively.
Yeah, okay, yeah.
And the other point is kind of tying on to the Health Watch point that I raised, which is that data held on Armed Forces Covenant and ex-veterans who attend appointments. I just wonder if perhaps a couple of times a year we could get data on that to see a comparison between the general population and those that are attending with waiting times that are veterans. Because in a lot of surgeries that I've been into and in many hospitals, there's often a lovely sign up saying that they do this. And then when I've actually revealed to people that I'm a veteran myself, it's almost been a, so what? So there's an element of education there, because I think, as you know, particularly the GPs, there is a tracking system that's in place for that, particularly on mental health, once again. So I'm not saying in every report, but I wonder if there's something that we can do, and perhaps I need to talk to the council here about it, about how often we can actually drill down into that. Thank you.
I think, yeah, that's a really good point. And I think the ICB itself wouldn't hold that data because we're not allowed patient identifiable information. However, the practices themselves would. So we would need to survey the individual practices to get that.
Are there any further questions? No. I have Mr. Peter Smith down as a public speaker on this item. This is to do with GP provision, Mr. Smith.
This report just gives us people going through, how quick you can get them through, and how long it takes them to get there. There's no outcomes, although we're all seeing the outcomes of it in all the figures, if you look at them. The last 3 years have been an unmitigated disaster. By not raising the health issues with the government, decisions would have on the physical and mental health of the nation, this service failed in its duty of care to the public. This allowed the government to push, and its experts, to push restrictions on services and real healthcare service. The consequence of this failure have been falling life expectancy, a massive increase in pharmaceutical drug dependency, suicide rates that are continuing to rise, excess death rates 10-20% up on any time of this year. We have 500,000 people who have reported to the government MHRA red yellow card system about adverse reactions to the MNRA gene therapy experiment, whom the government have ignored and who cannot get any help with their health issues because the government's refusal to acknowledge them. This willingness to allow government to dictate when and with what the people of this country are to get medical treatment has been a disaster for the reasons listed above. This report does nothing to address this problem, where the government and its medical services ignore the real health care and force more medical experiments and pharmaceutical products through their online pharmaceutical outlet. The people who pay for fund this broken system are being failed by everyone in it. It's apparent that money
Mr. Smith,
has
this is about GP provision.
On services than actual
This is
healthcare.
about GP provision, not the COVID vaccine.
Part of the problem. This was allowed to happen. It's a top-down thing. There's no information. That's a horrendous list. Death rates,
Okay.
20% up, yeah? No mention of it.
Your points are
Yeah.
noted. Thank you very much.
500,000 people can't get healthcare.
I have a
These are the people on the front line that should have put their hand up, yeah, and told the government what would happen. Anyone with half an eye could see what would happen.
I have Councillor Cape who wishes to ask you a question, which I will permit.
It's a question come observation. I mean, I personally have had some excellent treatment from the NHS in the last 3 months, and I can't fault it. And similarly, I care for a disabled mother at home, and all I can say is the GP, sorry, they do a brilliant job. So stop hitting them. They have helped. My mother was 82-year-old with critical illnesses, so I do not recognise the inequalities that you are expressing to these people here. Sorry.
Thank you, Councillor Cape, and I think the committee would generally accept your view, and it certainly mirrors most of our experiences. In which case, unless there's any further questions, which I don't see any indicating, I'd like to thank you all very much for coming to give us this update, and we look forward to seeing you at the committee at a future stage. Thank you very much for your time this evening. Thank you.
Thank you very much. Thank you.
Thank you. We now come on to item number 9, which is an update regarding the George Eliot Hospital, and we have Jenny Northcote, who is Chief Strategy, Improvement and Partnerships Officer at the Trust. Jenny, can you hear us okay?
I can hear you. Can you hear me okay?
I'm just asking our person to put the volume up a bit.
Okay. I'll try and project a little as well.
That's fine. That's good. That's
Is that
good.
better?
That's good. Brilliant.
Lovely.
Well, whenever you're ready, that would be great. Thank you, Jenny.
Thank you very much for allowing us to submit our update. And obviously this is on the back of previous updates that have been provided. And I think that David Altringham, our Managing Director, has previously come to your meeting to provide. Obviously, we submitted a report and an update, so I'm assuming that people have had the opportunity to have looked at that report, and I just wanted to highlight a few sort of key elements from that report, if that was permissible and okay with you, and then I'm more than happy to take some questions. What I would like to say is, as you will appreciate, I'm representing a hospital which has a number of specialties and a range of services. It may be that I'm not able to answer every single question, particularly if they might be clinical, but of course I will take anything back that I'm not able to answer here today. So, by way of update, we tried to cover off some of the key points that you asked for us to cover, and so I'll try and draw attention specifically to those particular items. So firstly, just to say that obviously George Eliot Hospital is the local district general hospital, and it covers Nuneaton, Bedworth and rural North Warwickshire, but we also cover Hinckley and Bosworth as well, so I think that's probably worth pulling through. In the first part of the report, I've tried to give you a bit of a flavour in terms of the impact of winter and some of the challenges that our hospital colleagues have faced, and in terms of providing services for our community. And the first thing I wanted to just indicate, similar to the GP colleagues, is just the sheer additional volume of demand that we've experienced. There is an error in the report in terms of the data for those of you that have been eagle-eyed. What I was trying to indicate in that first paragraph was the fact that the activity in emergency attendances has significantly increased from 21-22 to the current period, and you'll see that increase from the circa 100,000 to 100,000, and so I think that is of significant importance to say that the demand has significantly increased, and that's around 17.5% when it's projected for the whole year. So if you can imagine a 17.5% increase in terms of activity and demand, that's a huge increase. And that's been due to a range of things which you'll have all heard about in the media, and some of my colleagues on the primary care update also provided. So things like flu and also strep A, less so on COVID this year. What I am pleased to say, though, is that in terms of the performance as a trust, you've got some figures in there in terms of our A&E performance and also where we benchmark, and we have been like within the top, in the top sort of 5 and in the top sort of upper quartile nationally, and that is considerable to celebrate for the work of our colleagues. But obviously we would still want to improve that further, because every weight that a patient has is difficult when somebody's in need of care, and we appreciate that, obviously. We are also aware that people are concerned about waiting times for elective treatment, and we've tried to give you some flavours there in terms of where we are nationally. And whilst again there are people that are waiting longer than we would hope that they would wait, when we compare ourselves to the national picture, we are doing really rather well in terms of reducing our waiting list, and particularly targeting for waiting times in respect to cancer, for example. And you've got some figures there in terms of the position on our long waits. You'll also see that we've made a specific focus in terms of trying to increase our diagnostic capacity, which obviously is really important, because that's how people first enter into a pathway of treatment. And so we're really pleased that we've been able to open our new diagnostic community centre, and that has seen a significant increase in our ability to support people with their diagnostic care and get them into a pathway of treatment if that's needed. We do have challenges in relation to staff, both in terms of sickness and in terms of some recruitment issues. That's a national consideration and is something that is uppermost in our minds at the Trust. But later on in the report, I give you some further details in terms of some of the work that we're doing around that, and also again where we are benchmarks favourably in terms of both of those. And we're also doing a significant amount of recruitment and trying to do local recruitment. I was asked to cover the financial position in brief for the organisation, and so we've included some high-level figures around the position of the Trust. And you will see that we were on a break-even position, but we are expecting, however, for a deficit in this financial year, and that is related to responding to a lot of the additional activity and our requirements to have opened some additional beds to provide additional support during the winter period, but also pay awards that weren't necessarily fully funded within the settlements. Obviously, I'm not the finance director, so I will try and take any questions on that if people have any further points to make. In terms of the quality and safety, that's obviously central to the work that we do as an organisation. And one of the things I wanted to just draw attention to under our quality and safety piece is that we've recently done a lot of work with patient public involvement and our volunteers to understand some of the experience that carers and patients have, and to try and work with our service users to ensure that we're addressing their needs and responding to their feedback. Then finally, I was asked to just include an update in respect to hospice and end-of-life care. And as you'll see from that report, there is still a disparity in Warwickshire North in respect to end-of-life care provision. However, we have worked hard to increase the offer for people to be supported to die in their place of choice. And we've been working hard with Mary-Ann Evans, which is one of the local providers of hospice care, as well as working with our staff in terms of the inpatient care. And you can see there the figures that have that are reported in terms of supporting people to die in their place of choice. I hope that gives a flavour of some of the things that have been happening and also covers the particular points that you wanted covered. Just finally, in addition to what's in the report, and just picking up on some of the conversations that have happened to date, is George Eliot is really pleased and proud to support the military covenant. So just mentioning that, I didn't include that in the report, but we've got 2 champions that are within our organisation that are linked into that piece of work, who are ex-service people as well, which is great. We are doing a number of things in terms of virtual wards to enable us to offer care and support to get people home quicker, but be supported, and that's using some of our digital capability. And finally, there's been a lot of conversations about ambulance handovers and concerns around that, and again, that's been one of the areas where we've been able to perform quite well, supported by our ambulance colleagues. And whilst we have had some periods where we've had ambulance waits, we have not seen the level of ambulance waits that have been reported in other areas. I'm pleased to say. Happy to take any questions.
Thank you very much, Jenny. We do have a public speaker on this item, and that is Mr. Peter Smith. Mr. Smith, this is to do with the hospital.
Another report that doesn't seem to give us an awful lot of information or indication where this hospital stands. What's driving the increase in emergencies? Why is life expectancy falling in the area? Rise in stillbirths, deaths exceeding the average nationally, a significant rise in cancer referrals, staffing shortages and sickness. Has the Elliot done any yellow card reporting to the MHRA for the recent rollout? No indication there. With the cancer and the stillbirths, could this possibly be driven by the vast array of wireless technology you've installed on the maternity block, been negatively affecting people using the maternity, the wider hospital and nearby residents? Do you have any...
Okay, you're not speaking to the item, so I'm cutting you off. Are there any questions from councillors? Councillor Shires, thank you.
Pardon?
I'm cutting you off because you're not sticking to the item, and you're just promoting conspiracy
It's the
theories.
hospital.
You are putting
It's the
public
health.
safety at risk. Councillor Shires, your question, please.
I think that's a little rude, Kyle.
Can you turn your microphone off? You're not sticking to the item. Every meeting I
item's
allow
the
you to
hospital.
speak, but I ask
It's
you
health.
to stick to the
What?
item. You are not.
The item
This is about
is
the
health.
hospital and
It's
not
made
about...
various statements.
This is not about the vaccine rollout. This is about the hospital.
500,000 people think it is, being ignored by your corporation.
And we've asked you to provide evidence, but you've never been able to do that. So
It's on a
can you
government
turn
website,
your microphone off?
MHRA.
Can you
Look
turn
it
your
up.
microphone off?
That's the reporting system, yeah, for all the rollout
Can you
of
turn
any
your
new
microphone
drug.
off?
Any new drug.
Turn your microphone
If you don't
off.
know that, then you really shouldn't be chairing this.
Turn
I
your
think the lady
microphone
up
off.
there would know.
Turn it off. Councillor Shires.
Thank you. And thank you for the report. Actually, I found it quite useful, and I'm sure other members did as well. And Mr. Smith, this wasn't specifically about any particular speciality, whether that be cancer or maternity or any particular rollouts of medications or anything. So this kind of report as would be just an overview of really how the hospital is at the moment. But what did concern me was the financial position. So if we're already sort of 8 months in with a reported deficit of 2.1 million, I'm just wondering how you're planning on bringing forward all your plans for recruitment, retention, health, well-being, opening more beds, etc., when actually there isn't any money there to do it. But is there a way of the George Eliot? I know you've got the George Eliot charity of actually securing further funding, because myself, like other members, have used George Eliot Hospital for family, and have always received exceptional care from the NHS and George Eliot itself. So that is, I know, a real concern of us, because the NHS is obviously extremely important. Thank you.
Thank you for that. And as I say, my Chief Finance Officer would probably be much better placed to answer the question, but and I can come back to you. But what I would like to assure people in the committee is that that the way the accounting sits within the finances, etc., that we have various different targets and target deficits and break-evens, and therefore I wouldn't want to give the impression to the committee that the hospital was in any sort of danger of not being able to provide services as a consequence of the financial position. It's quite a technical sort of scenario in terms of the way the finances work, etc. But and we will basically have an allocation, and we will deliver our services, and we will have a target to work towards. So I wouldn't want people to think that we've suddenly got to find £2 million and we'll be cutting off services, etc., because that is not the position. It's just the way we have to account for our funds and the way we have to work in relation to sort of reporting on the finances. So I can assure you that that doesn't mean that we'll be needing to cut services. What we will be doing, however, is be working to ensure that we increase our productivity, and that we are working efficiently and smartly in order to provide services, and so that would be the way we would. There will be some challenging requirements with the funding settlements that we are yet to be confirmed, and the financial position within the NHS is challenging, it's fair to say. However, I certainly wouldn't want people to feel that that the hospital was in any sort of financial danger, if you see what I mean. And I can point you to the fuller reports on our website, which has all the detail of the financial positions under the governing body board reports.
Thank you very much.
Have we got any further questions for Jenny from the committee? Jenny, I just wanted to ask, so in terms of the elective waiting list, so essentially what you're saying is the vast majority, probably around 95%, if not more, are waiting less than a year for their surgery. Am I right in saying that?
Yeah, obviously there are particular rules about how things are calculated, but essentially there was a specific set of targets around ensuring that we recovered from COVID, and that we prioritised clinically the response in terms of bringing people forward for their treatment. But there was also a specific focus on cancer because of the for obvious reasons in terms of those specifics. So those are the figures that are quoted.
And in terms of the 62 individuals who essentially waited a year or more, I mean, would you know anecdotally, were those 62 people awaiting the same sort of surgery? I don't know if there was a particular specialism that you may have been lacking that has led to that wait. Do you know that?
I don't know that specifically. As I say, I think what's probably important to say is that all our waiting lists we have to clinically assess as well, so that review is happening. And also we've just recently set up another provision where we are in touch with people that are on the waiting lists, so that we can actually try and support people whilst they are on the waiting lists, as well. So but it'll probably be across a number of specialties, but I could find that information out if you wanted it specifically.
Yeah, I'd just be interested to know that's all. Any further questions for Jenny Northcote? No? Oh, sorry, yes. I completely feel. We've got Julian Gutteridge, councillor, who's portfolio holder for health. If you want to come in, Councillor Gutteridge.
Thank you, Chair. Good evening, Jenny, and thank you for a very good report. We lock horns quite a few times over the last 12 months. I first of all would like to take a personal thank you. In the last fortnight, my wife has had a procedure there, only had to wait 2 weeks to go in. And also my daughter had a baby. She went in at 8 o'clock and at 10 o'clock she'd had a baby, and it all went well. I'm very thankful for you at the George Eliot. The staff were unbelievable, very professional and everything. I also would just like to thank you, because I know we have talked with David Edgington a few times, and the end-of-life care. We were very keen for end-of-life care, that people, unfortunately, who were passing away didn't die on a trolley. And you've made some rooms specially there so that end-of-life is peaceful and they go with dignity, and I thank you all for that. Thank you.
Thank you, Councillor Gutteridge. And I think whilst we're here this evening, we should have a vote of thanks for the Mary Ann Evans Hospice, who have actually increased their hospice at home capacity for that very reason. So I'm sure the committee will unanimously agree to support that vote of thanks. And I hope that can be minuted and passed on to the hospice, please, Maria. In which case, Jenny, there's no further questions, so thank you very much for your attendance. As always, thank you for the detailed report. We do genuinely find your reports very detailed, so thank you very much. And thank you for your attendance. Thank you.
Thank you very much. Good night.
Good night. Item number 10 on the agenda is air quality management, and we have Andrew Snowden, who is our senior environmental health officer. Andrew, would you like to present your report to the committee, please?
Not quite sure what the committee do know already about what Nuneaton and Bedworth do in terms of air quality monitoring. So I'll just start with a very basic overview. Apologies, it is a bit basic and you're already aware. But the Environment Act 95 puts a requirement on Nuneaton and Bedworth, along with other local authorities, to monitor air quality for a specified range of pollutants in their districts. And where problems are found with particular pollutants, to put in place an air quality action plan and implement remedial measures. So of all the pollutants that we're asked to monitor, the only ones that we need to physically monitor is nitrogen dioxide, just because we wouldn't find a problem with other compounds such as benzene and ozone. That's just not something that, since the implementation of the air quality regime, has been found to be a problem. So the residual issue we have to deal with is nitrogen dioxide. So we do that by using 40 plus diffusion tubes on busy roads all over the borough. And we collect those monthly and we get a monthly figure, which is then annualized. So back in, it's before my time, but I think it was 2009 and 2011, we ended up having to declare 2 air quality management areas. One covering Leicester Road Gyratory, which was the first one, for exceedances of nitrogen dioxide. So the level that the government set, which we have to meet, is 40 micrograms per metre cubed. So that was exceeding in that location. And then I think it was a couple of years later, Midland Road, Central Avenue and Corporation Street was also exceeding. So that was declared as our second air quality management area. In the intervening period, there was lots of, the government and the EU really had put requirements on engine manufacturers to be making particularly diesel engines cleaner during that time. So you'll all have heard of the Euro 4, Euro 5, and at the moment Euro 6 diesel engines, which went a long way to improving the nitrogen dioxide problem. In Nuneaton and Bedworth, we didn't find the same drop-off in nitrogen dioxide as in other places. So in those air quality management areas, or particularly in the Midland Road one, it stayed stubbornly high. Admittedly, they were not huge exceedances, but they didn't particularly drop off in the way that the national trend did. So we still had that up until 2020. Now, obviously, when the pandemic came, those levels dropped, understandably, due to the lack of traffic at that time. And if I can now just explain at the reporting system, just because it explains why we're still talking about 2021 data, which now feels a little while ago. But the annual, so one of the requirements that we have is that every year we produce what's called an annual status report. And that collects all the data and reports on where we're at with air quality. So we're required to produce that for DEFRA in the summer. So in this case, we're talking, so I'm here to report today, the 2022 annual status report, which we produced and sent to DEFRA last summer, which is the deadline we have to do it. And that subsequently approved by DEFRA, but it reflects 2021 and the levels at that time. So this coming summer, we'll be producing the 23 report, which obviously will characterise 2022. So that's why it seems like we're talking about data that's just perhaps a couple of years old, but that's the one we're kind of working on at the moment. So when we produced the, we call it the ASR, the Annual Status Report, 2022, we found that there were no exceedances of the nitrogen dioxide objective in that year. So that includes the air quality management areas. As I say, we'd seen the marked reduction in 2020, but we knew that would happen. And we did see a bounce back, but we didn't know how much it was going to be by, whether it would push us back into exceedance again. But we saw the levels generally increase by about 5%, 5.5% into 2021. But that still kept us compliant with the air quality objective that we had to meet. So that was good news. In the Leicester Road gyratory, our highest level for 2021 was 25.9 against an objective of 40 micrograms. And in air quality management area 2, the Midland Road area, that was 35.2 as compared to the objective again of 40 micrograms. So there's some, some leeway there in terms of the distance to the objective. Obviously, 2021 was still impacted, certainly in the early part, by the lockdowns. So it's a bit early to really draw conclusions, but now it's a case of ongoing monitoring and just seeing whether that becomes a long-term trend, which we're hopeful that it will. As I say, where we've got air quality management areas declared, the legal requirement is on us to produce an air quality action plan. We had one from the time of the original declaration, possibly well over 10 years ago now, but some members will be aware because it sort of went to OSP sort of 18 months ago now, and then subsequently to Cabinet, that we implemented a new air quality action plan, an updated plan. And that was approved by Cabinet last spring, I think it was April time. Of the report that we took to Cabinet at that time, the change that Cabinet wanted to see was that we retained the Leicester Road gyratory air quality management area. The advice from our consultants, and that had been agreed by DEFRA, was that we could revoke that, but members were conscious of the amount of building that was going to take place in the north of the borough, and so wanted to keep the air quality management area to ensure that the monitoring took place so that we could see whether anything changed in that regard. So the final version that went to DEFRA had the recommendation to keep air quality management area 1, the Leicester Road gyratory, and in the summer last year that was approved by DEFRA, so they were happy with our air quality management plan 2022. At that point, and this that plan predates the information I just mentioned about being compliant with the air quality objectives. At that point, we did have minor exceedances, but that was based on 2019. So the thrust of the plan really was that it was proportionate to the level of exceedance, which was quite small, and that the measures that we set out to take actually were kind of in proportion with what exceedance we had. Now, because we're obviously a two-tier authority, and a lot of the issue relates to road transport, it's often the Strategic Transport Authority, Warwickshire, that have direct control over what happens. So it's a lot of the time it's us liaising with them. So our measures that we set out in the action plan, certainly from a transport point of view, were largely schemes that Warwickshire County were implementing, and that we asked them to look at air quality as part of that. So some members might recall Dan Cresswell from Warwickshire come into a previous OSP last October 21, I think it was actually, and giving a presentation on how the air quality reductions as part of the Transforming Nuneaton programme, the highway improvements, elements to that, which would then have taken us below the air quality objective in that area. So I have just got a brief update on, and members may well be aware of some of these anyhow, but Dan Cresswell just confirmed to me that the Abbey Green cycleway is due to start construction towards the end of Q1 of 2023, so that's not too far away, and that contributes towards our objective of alternative types of transport. And then there's some quite significant highways changes to the junctions with the ring road. From our point of view, the main one being the Corporation Street junction onto the ring road, and they looked at that particularly in terms of modelling air quality for those changes, which made some fairly substantial improvements to air quality to do with reduced congestion. And those works are currently scheduled for Q1 of 2024. So we're just over a year's time. The other element, which I just thought I'd mention, is the Coventry all-electric bus city. Obviously, it's Coventry, but there's the transboundary routes which come onto our patch, and particularly, I think it's the number 48, which runs along Midland Road. The latest update I've got is that the National Express have already got some 50 electric buses in operation, and on the cusp, I think, of ordering quite a substantial amount more. I think Stagecoach, which I believe to be the number 48 route, they're still in negotiations around charging and where the charging infrastructure is going to be. So I think that's going to be in the second wave of that scheme. But members may well know about that from other sources, because obviously that's something that crosses into other areas that you'd be involved in as well. That provides just a brief overview of where we're at, or at least where we have been recently. I just wanted to mention a few things that are sort of on the horizon in terms of air quality as well. Probably a lot of people will be aware that whilst we are focused on nitrogen dioxide, because that's what we've been required to do, there's been an awful lot of attention on small particulate matter, what they call PM 2.5. So that's the very fine particles and the health impacts of those in terms of cardiovascular disease, neurological disease, and certain cancers. That's really raised up the agenda in the last fairly, 2 or 3 years, I suppose. But I mean, it was always in place, but it's always been a central government level that they had to meet, of currently 20 micrograms per metre squared. So it was never specifically a local authority objective, other than we had a sort of general duty to work towards reductions, which we've always done as part of our measures to try and reduce nitrogen dioxide anyway, and as some of our work on domestic solid fuel burning and that sort of thing, as to show that we were trying to work towards that. But when the government brought in the Environment Act in 2021, they committed to setting a long-term target for PM 2.5, and the level wasn't set at that point. But last year, they'd put a consultation out to reduce that target level to 10 micrograms per metre squared across England by 2040, and a population reduction target of 35% by 2040 compared to base year of 2018. They're considering the responses currently, and we'll see whether that ends up being the level that's set. What we don't really know, and it is being reviewed as part of that, is what the local authority role in that is going to be. So, as I say, currently we have a sort of general duty, but no specific level to meet. We may have more, we may have the same sort of duty. One of the challenges for the government in setting the duty to be with local authorities is with PM 2.5, a lot of it's out of our control because we get quite a lot of transboundary PM 2.5 from European agriculture, which particularly affects the southeast. Some of it's natural. So we're not in complete control of it. So I think that's probably why we would never set the specific level to meet ourselves anyway. And obviously that would continue to be the case. So it's one to have on the radar, but we don't absolutely know yet what that's going to be. But certainly the level will be set for central government and or local government to meet. In advance of that, DEFRA were in contact with us a couple of 2 or 3 months ago. They were looking at installing a particulate monitoring station. They were considering several sites in the district. And they came and met with us or one of our officers for a day and went to physically look at the sites. They've finalised a site in or around Malace Close in Bedworth, so they'll be doing particulate monitoring themselves, assuming that all progresses through. So there'll be a local monitoring station for that. That primarily will be DEFRA's, and they'll use that information in terms of the government having to meet that, whatever level they do set ultimately. But it'll be useful to have a local source, because at the moment I think the closest one is in Coventry somewhere, and that's what DEFRA used to model our levels of PM 2.5. And from that, we've always been compliant with the current 20 micrograms. The highest levels are 12 micrograms at a location in an area of Bedworth, which is as compared to an air quality objective of 20. But obviously that could come down, if the consultation, if it follows with the consultation, that would come down to 10 micrograms, and that would push a marginal exceedance at part of Bedworth. So we sort of watch this space as to what action we need to take on that. And just finally, there's been updated guidance, both the technical guidance and policy guidance on air quality that we've become aware of just a few weeks ago. So we haven't fully digested it all, but I think the main message has been to sort of, for DEFRA to try and raise the profile and the level at which things are done within local authorities. So there's quite a lot of increased emphasis on the Director of Public Health. So in our case, that would be a Warwickshire. You know, having a real active involvement in air quality, signing off air quality action plans and annual status reports, which hasn't been the case until now. Also that that person sits on the air quality steering group, and as well the members and chief exec of Borough Council as well. So we've yet to go through it all, but I think that's the main thrust of it, is that they're just trying to raise the level in the organisation that these responsibilities sit at, just to make sure that those with the power to make things happen are aware and can do that. So I've kept it fairly brief, and I thought if there's any particular issues, we can do it through questions. Obviously, I've circulated the annual status report, so that covers, you know, the state of play relatively recently. So, any further questions?
Yeah, thank you, Andrew. As always, every year, detailed, concise report. Thank you very much. We have a public speaker, Mr. Peter Smith. Mr. Smith, this is about air quality, so I'm happy for you to speak. If it's not about air quality, I will cut you off.
Thank you very much. We'd all like good air quality. Maybe a little joined up thinking would help, yeah? Every other decision you've made outside of this, yeah? Building a superstore on Corporation Street with a petrol station, yeah? Removing all the car parking in town without any finance to replace it, lovely report, mate. You know what I mean? It sounds great. You've kicked the can far enough down the road, not 2040, but I'm sure you'll do as Deborah says. Who cares about the residents, eh? No joined up thinking at all. It's a great report in and on its own, yeah? But it ain't joined up to any of your other decisions, yeah? You've taken all the car parking and you're looking to take more, yeah? Which causes massive congestion because no one's got anywhere to park, yeah? You're going to build a superstore on Corporation Street and there's no real room there to do anything with the roads without destroying a lot of properties, yeah? It's joined up thinking. Every decision you made outside of this, yeah, adds to the problem that it ain't going to be solved, but you won't be here in 2040, will you? So it don't really matter, yeah? So clean air is really...
Well, speak for yourself, Mr. Smith.
Nothing you do outside of any report
I intend to be
joins
here
with another
2040.
one.
Okay. Your points are noted. Are there any questions from the committee? Councillor Cape.
Yeah, just for some clarity, because I'd like to show that I can think joined up. Am I right in saying that you only measured in 2 sites, so therefore we only measure at fixed sites, AQMA1 and AQMA2, which is now being removed?
No, we measure, I think it's about 44 sites. That the 2 air quality management areas are more saturated with monitoring positions than the rest of the borough. So I think there's something like 7 or 8 monitoring points in each of the air quality management areas. So we got a good feel of what's going on there. And then the rest of the borough is more, the density of monitoring positions is less because we're less concerned with the levels that in other positions. Yeah.
I'll get there. I'm also right in saying that stationary traffic causes far more pollution than moving traffic.
Yeah, particularly not stationary per se, but the stationary to moving. So something that so when they've done assessments on buses and things where there's speed humps and they slow right down for a hump, speed up again, it's the acceleration. Which is because that's such an inefficient point of the driving cycle that normally spikes the levels. So yes, something that moves at a constant speed, and obviously the closer to the sort of classic 56 mile an hour, the better, because that's where the engine's working at its most efficient. But anything that's at a constant speed without stop starting is the best. So the best flow that you can have, the better. Stationary in and of itself isn't great, but it's the starting and stopping really, yeah.
It's the last point, and it's one for the cabinet to consider in their planning. They may already have done. I'm unaware because I wasn't there at the time that the last consideration of air quality went in. But is it possible under mitigation for building? I know I'm going into planning regulations, but you've mentioned that we're a 2-tier authority where Warwickshire controlling a lot of what we do. Where there are major construction works going to take place that Warwickshire already know about and have agreed that there will be mitigation on some of the congestion elements that they're going to do there, will there be any plan to put some kind of mobile monitoring funded by them in place at the sites where these large builds are going to occur, so that we're being proactive about it rather than waiting for a report a year from now which says that we may have exceeded due to the congestion in that particular area?
Well, we have, when we have a planning application, so we've got an adopted Warwickshire-wide supplementary planning document relating to air quality, and that sets out how, in the planning regime, air quality should be managed. So it puts a requirement, so developments above a certain threshold in terms of size or certain types of development, it puts a requirement on them to do an air quality impact assessment. So it puts the emphasis on the developer to do that work and to come back to us with the findings of that and what mitigation they would put in place. So to come back to one of the public speaker earlier on talking about the Morrison's development on Midland Road, that's one that would have applied there. So there was, and we spent a long time, or Sarah, the officer who covers it on a day-to-day basis, to and fro to the air quality consultants on that development to make sure that was right, because in the early phases there was quite a lot that we wanted to see within the report that wasn't there. And so that took quite a long time, and eventually we got where we wanted to be in terms of having an accurate report. And so I wanted to mention that just because there is joined up thinking in that sense. The planners and ourselves as a environmental protection team in Warwickshire do all work on these things together, and it's through the conduit of the supplementary planning document. So the emphasis is on the developer. They wouldn't normally, in our experience, they wouldn't normally physically measure it. Normally modelling is fine. So they take a lot of the data that already exists. They can look at the number of the trips that it generates and the types of vehicles and all this sort of thing. Quite sophisticated modelling, which is exactly what happened with Morrison's, and then predict what the level is going to be.
Thanks for that. It helps my understanding and perhaps answers some of the questions that Mr. Smith raised.
Thank you. Andrew, sort of on the point about the planning regime, are you able to give some examples of condition? I mean, and you're not a planner, I appreciate that, but are you able to give some examples of where our planning authority could place conditions on applications to mitigate air quality?
Most common one that comes up a lot and is put onto lots of application relates to the proportion of electric vehicle charging points. So often with the residential developments, they have them, but with the Morrison's development, the number of electric vehicle charging points there was stipulated as part of that, as part of the air quality report that was done, and then it was put in by condition for that. Low nitrogen dioxide boilers into residential, that regularly goes onto applications or to planning permissions. And then where you got the bigger applications, and this is again back to the supplementary planning document, when it gets to a certain threshold, they've got to do what's called a damage cost calculation. So they work out the damage costs, and then they put in a mitigation equivalent to those damage costs. So it might be that they implement transport, have a transport plan that puts into place certain types of transport. That's the sort of thing. So they don't crop up very often, but certainly electric vehicle charging points, low NOx boilers is very common. Lots of the applications will have that.
Sorry to put you on the spot. Do you think our planning department always go above and beyond to put those conditions on applications? And if do you think there's anything more that could be done from a planning perspective in this authority?
Well, I've never known them. So we would request the conditions as a consultee to the planning process. I've never known them not put them on if we've asked them to. Partly because it's backed up by the SPD, it's robust, a robust way of doing that. Whether we could do more, I mean, again, this comes back to the level of exceedance that we have against the current government objectives, because we've always been very conscious that we only had, and we may not have any exceedances now, but even at the time doing the action plan, we only had a very minor exceedance. So it was keeping it proportionate, because obviously we're focused on the air quality, but obviously as members and as planners as well, there's always that kind of environmental, social, economic balance to be struck. So it's striking the balance between the level of exceedance and those other factors. So I don't think I can really say whether the planners do enough, but we're sort of bringing it to compliance legally at the moment. So yeah.
I just wanted to raise some things about the diffusion tubes that we use. First of all, I am pleased to see that we've got a number of diffusion tubes down Bermuda Road and next to the bridge that's going to be used for the Bermuda Connectivity Project. And I do think that when that project comes to fruition, we should monitor those very closely. In terms of diffusion tubes, what is because I've obviously seen the map, and we've got a lot that are scattered near to the town centre, where we would naturally expect higher pollution in the air. but I do see others just scattered around all over the place. What is the threshold to have a diffusion tube? If I said to you as a councillor, I want a tube on such and such road in my ward, what would you say to me is the threshold?
The locations of lots of the tubes were already in position when I came in, but I believe that as a rough guide, set out in the guidance, I think it's something like 20,000 vehicle movements a day, but don't quote me, I might not be right on that. But it's not absolutely rigid in that sense. So we, for example, you mentioned the Bermuda Road, that we put those there purely. So obviously that road at that point in time would never have exceeded that vehicle threshold. That was purely because we were aware of the proposal, and we put them in early to get some background data of what and we've had them in there for at least 5 or 6 years, I would think now. Yeah, we will. Yeah, absolutely. And we sometimes get queries and things. So we've recently relocated one to a position in the long shoot because somebody had raised an issue around the development that was going on there, and that the road at this point in time seemed to be a lot busier. So we can put them, where we want really, if we think that there's an issue, or there could be an issue, or a request is made. Obviously, we can't put them everywhere because there is a cost to it. But sometimes we'll take them from one position because it might have been there for quite a prolonged period of time, and there's nowhere near an issue, and just relocate one of the existing tubes we've got to somewhere else. So, yeah, I think as a basic, I think it's 20,000 a day, but it's not a set thing. We can put it wherever, really.
And just one more thing I wanted to clarify as well. On the diffusion tubes, there's been some allegations made in the borough that the council purposely puts the tubes a certain distance from the road in order to scupper the data, to make it look like a certain area has less pollution. I mean, I presume there are sort of guidelines from DEFRA that say, you've got to have it within a certain metre from the road, and I presume that we completely comply with all that.
There's 2 ways of doing it. So it's set out in TG and TG 22 now. But you normally have, there's 3 types of locations you have. So you either have the urban background location, which is set away from the road completely, generally speaking. And I think we might only have 1 of those, or perhaps 2. And then the rest of the tubes are either called curbside tubes, which they'll be on the lamppost physically on the curb, as it says on the tin, or facade tubes. So we use the curbside tubes in the first instance, because they're obviously on public infrastructure. And if that shows it not to be a problem there, then we can reasonably assume, because the drop-off in terms of pollution levels is quite quick, we can assume that by the time it gets to facade level at people's houses, that it's not a problem there either. So, but particularly in the air quality management areas, obviously where we have found elevated levels, we've got lots of facade tubes in those positions. So, and that's really the level you're bothered about, because that's where people are exposed to it. It's what they get at home, and that's the primary concern. So we'll put facade tubes out in those positions, and then we can measure the levels at the front of someone's house, basically. So, yeah, they all comply with the requirements. Obviously, unless we're made aware of something that isn't, we'll go and look at it. But the distances from the curb to the roadside are all set out, and you'll perhaps see that in the annual status report, so that they're all open and transparent. You can see that it might be 3 metres from the road, and if you've got a level of X, well, that is either 1 metre or 3 metres away, and that gives you an idea of the context of it.
Brilliant. Are there any further questions from the committee? Councillor Singh and then Councillor Wright. Councillor Singh.
Just asking, as we know, the price of gas and electric's gone through the roof. A lot of people are moving to using wood burners. Are there any policies restricting this use, as this is causing a lot more pollution than...
You're right to say that, particularly in the context of PM 2.5, domestic solid fuel burning, so wood burners, is a real issue. I think it's disputed to some extent, but I think that the stats that are often mentioned that 38% of PM2.5 now comes from domestic solid fuel burning. There's a couple of things to say, I suppose. The legislation changed in terms of fuels that you could burn. So previously, you had a wood burner and you could burn wood and that was it. Or you could buy any wood and burn that. That's changed, I think it's perhaps about a year ago now, so that you can't sell wet wood. It has to meet a certain threshold. That's enforced by trade-in standards because it's obviously in a retail sort of environment. So that, and then there was also the banning of straightforward house coal as well. So those couldn't be used. But the main framework for enforcing it all really is the smoke control areas. So the way it works is that if you have just a straightforward open fire, it's not illegal, you can have that, but you've got to burn within the Nuneaton and Bedworth, or the vast majority of it. There's a few little parts that are not, but the vast majority of it is covered by the smoke control area. So you've got to burn approved smokeless fuel. Alternatively, there are this is what quite a lot of wood burners can fall into, are what's called exempted appliances. So they're appliances that DEFRA have exempted to burn, say wood, for example, which isn't a smokeless fuel, but the appliances are more sophisticated so that they can burn it smokelessly by the mechanism of how it's burned. But it does rely on the wood being dry, and this is where the dry wood, the ready-to-burn legislation assists with that, really. So there are wood burners that are not exempted appliances, and if you burn wood on that, that would be an offence. And all these offences, aside from the ready-to-burn fuels, which, as I say, is trade-in standards, they're enforced by the Environmental Protection Team. So when we get complaints of smoke pluming out of people's chimneys and stuff, we'll investigate that. It's been a difficult one to investigate because we never had the powers to actually get into properties. And so it was always hard to prove because there's a defence in law that you were using smokeless fuel and that, you can still get some smoke from smokeless fuel. So it's always been tricky. But they've changed some of the legislation around smoke control areas now and the enforcement of it. So to be honest, I'm surprised because you normally find winter, obviously, is we get more complaints about this sort of thing. And given that like you say, you mentioned the pressure on household finances to do with fuel and such like, I'm surprised. We were anticipating a lot of complaints about burning, of solid fuel this year. It hasn't actually come to pass. So whether this is the ready-to-burn fuels legislation actually being quite effective, we don't know. But it's, looking at the complaints that are coming into the team, I've not noticed a lot particularly. So hopefully promising, yeah.
It must be really hard to police because I haven't ever seen anybody being prosecuted for anything for this offence. So you don't know what kind of wood they're using. They could be using any type of wood. So it doesn't mean they're using, what is supposed to be, the like you say, dry wood. Because I know of instances of people going up, cutting up pallets and things like that, using that kind of wood.
I mean, it's a technicality, but it's probably important to stress that the offence is to sell wet wood. So actually, if you've got your own stock of wood and you're burning the wood on an exempted appliance, you're still technically not committing an offence. It's the shops, for example, selling wet wood. So we wouldn't be able to prosecute somebody burning wood that's sort of like an old pallet or something. So there's that. We often can't. I mean, to be honest, we've never prosecuted anybody. That's right. Normally, I mean, we tend to find, to be honest, when we get a complaint, we go and speak to them. We obviously write to them. Most complaints don't persist, so we tend to get where we want to be. We get a resolution to it. I can't think of any complaints where we've had to sort of get to the point of almost prosecuting even. So I think the informal action we take normally is effective. But yeah, it's fair to say we've never prosecuted anybody for it. Not in the time that I've been here, anyway.
Councillor Wright.
Thank you for your report. Couple of quick questions. First of all, could the council be setting a useful lead on this issue by choosing electric whenever a council vehicle needs replacing, rather than locking ourselves into diesel for the next 7 years or so.
It's not something I know what, in terms of specifically what the arrangements are, but in general terms, obviously, yeah, any electric vehicles are going to be beneficial over diesel ones, but I don't know what contractual arrangements the council have in terms of its fleet. It would probably be for, I don't know whether, well, certainly be for others to answer. I'm not sure what the policy is.
I mean, I think we should always welcome electric where possible, but I would caveat, I mean, there was a good article in the Times, I think maybe a fortnight ago, and I think it was a council in London that had gone all electric on its waste collection lorries, and due to a number of issues which I can't remember, they're all now sitting in a lorry park, not being used, and the council is having to use vehicles from an agency, which is causing an additional cost on the authority to actually carry out its statutory duties. So, yes, where possible, but I would caveat that sometimes. Do you have any more questions, Councillor Wright?
I mean, as I understand it, the decision as to what we will be replacing the current fleet with is being taken in the very near future, as I understand it. So is this not a consideration we should be thinking of?
To be honest, I think it already is, because we had the climate change working party probably about 18 months ago, and one of the recommendations was to look at how we will have electric charging infrastructure across all of our assets to allow for electric vehicles when the time is right. But the other thing I'd say as well is we also have to caveat the point that a lot of the batteries that you have to put into electric vehicles are often sourced from various countries in Africa where some people are using child slavery. Is that something that we as a council want to endorse? I think not. Councillor Guthridge, who's the Cabinet member, wants to come in on this point.
Thank you, Chair. I'm not the Cabinet member, it's Sue Markham, but I can probably put a bit more meat on the bones. One of the reasons is that the vehicles on offer at the moment are not suitable for us. Also, in our super depot, we have not got the capacity to charge vehicles. To charge the vehicles at the super depot, we would have to put in a substation. And after the last fiasco with the previous administration, they budgeted on 800,000 to kit out the depot. And at 2.3 million later, we get it, and we've still now got to put a substation in if we want to go electric.
And obviously, if that's what the Green Group wants to do, and that's an option that's open, then obviously we have budget setting in a fortnight, and you could present an amendment to our budget to put that in. So, Councillor Kenner, I see you indicated.
Thank you, Chair. I just wanted to add a bit more context to your previous point about the electric vehicles that are sitting in waste, essentially. It costs £2.5 million a year, and it's actually Brighton and Hove Council, which I believe is the country's only Green Party-led council.
Any more questions on this item? Councillor Wright?
Yes. Okay. One other one other quick point. I mean, it's a question of vocabulary, but I think it's significant that the level of 40 micrograms per cubic metre is described as an objective rather than as a red line maximum. Shouldn't our objective be a year-on-year reduction?
Well, I mean, it's the numbers and the terminology set out by the government. So they direct us, to meet that objective. Obviously, from the point where we declared the air quality management areas, we were unlikely to meet it straight away. So by default, it almost becomes a year-on-year reduction. If and we hope we are compliant with that level now, I think there's still a general kind of requirement to try and reduce it further, because obviously it's a level that's set, but the lower the better, really. It ultimately, I suppose, how far you want to go with it and what measures you want to take becomes a question for members. At the moment, we're working to the government's sort of legal requirement, but I think it always would become a year-on-year reduction anyway, because it's very rarely, it's unlikely to take a big jump at any point in time, I think, obviously with the exception of COVID where it did, but that's obviously not realistic for normal circumstances.
Yes, sorry.
Councillor Wright.
Yeah, sorry. I do notice that on some of these sites, what the trend we see is increasing from 2017 to 2019, falling quite significantly in 2020, obviously, and now climbing again. So is that really the sort of trend we should be looking for? I'm specifically looking at page 19 of the report. You see, I mean, if we look at NB09, for example, that's climbing from 2017 to 2019, falling in 2020, and now climbing again.
Reports over there, but you would always have seen an increase between 2020 and 2021. That's inevitable. The question is, what do we get in 2022 and 2023 now to see whether that is, because what I don't want to come here and say is that, yes, that's it, we're compliant. And we are compliant last year, but compliance is really achieved over a number of years. And DEFRA would only approve, because DEFRA have to approve us revoking the air quality management areas. They want to see, I believe they want to see 10% under the objective for a sustained number of years before they would approve the removal of it. So that's the next stage now, is just to see, is this a trend? Is this the trend that we want to see, or is it a blip? All we can do to determine that is to continue to monitor. As I say, Leicester Road-wise, DEFRA were happy enough for it to be revoked, but they hadn't got the context of the house building and such like that was going to take place. But they wouldn't let you revoke based on 1 year or even 2 years, and certainly not if it was close to the objective. It's got to be, I think it's 10% below on a consistent basis to even begin to consider it. So as I say, Leicester Road met that, but Midland Road, Central Avenue, Corporation Street wouldn't meet that yet. So there's a safeguard in that there's going to be a requirement for ongoing monitoring and for the action plan still to be in place currently.
Thank you, Andrew. Well, there's no further comments from the committee, so thank you very much for your attendance, as always, and thank you for your time. And see you this time next year. We'll now move to item number 11, which is the overview and scrutiny guide. Before I go on to the recommendation, we have a public speaker, which is Mr. Peter Smith. Mr. Smith.
The nature of this document, this report, is very concerning, really. An attempt by the Cabinet to dictate to the rest of the borough what happens without any scrutiny, oversight or involvement from the public. A group of people that only had 15% of the vote when they were initiated, wishing to dictate to the 85% where and what happens with our money. I'm sure everyone would be concerned if they looked at the people on that Cabinet, that they can't be trusted. at all. Yeah, but I'll say I think it's very concerning for the public, and hopefully, if you don't bankrupt us before, we'll be able to vote you all out, or remove you anyway. 70% of the people in this borough never had a choice at the last election. No choice. You lot all Labour. No choice. That's why they didn't vote. Yeah? Which means you have no mandate. Yeah? You haven't had a mandate. The last lot didn't. You've never had over 50% vote in this town for years. Why? Because the public know how corrupt this council is. Yeah, we've learnt the code. Commercially sensitive means you're being robbed. Yeah? And you can't see it. But it will be exposed. Trust me, it will be. Very soon, yeah, like I say. You've only got to look at the 5 people involved and what threatening people with legal action, lying from the chair, inventing letters from imaginary residents, weren't even on the electoral register. Yeah. Thanks for that, Mr. Wilson, and Mr. Croft's wonderful answer to it. Yeah. So that's the nature of the people on this cabinet. Yeah. Corrupt. And it will all come to light before much longer, I feel, if we can just get one good policeman to honour his oath. Yeah?
Okay.
There's no scrutiny from you lot.
Thank you, Mr. Smith. Obviously,
I've been, the times I've been in here, yeah, and you just get a nod and everybody goes...
Obviously, you've just made an allegation that a certain individual is corrupt. That's a very serious allegation, and I think that Councillor Golby wishes to make a point of law. Councillor Golby.
I do believe you've just made a very serious public allegation, and you do need to back it up. I've said this before. You come into the chamber, you accuse people of corruption, you're going to need to start backing it up, because you cannot keep doing this, what you're doing now, under the banner of whatever it is that you're doing it under the banner of. You're alleging corruption. What do you mean by corruption? Who is corrupt and how are they corrupt? That is a very simple question to ask, being as you've got 2 cabinet members sat here now and you have just openly accused us of corruption. So how? How are we corrupt and what are we doing?
I'm going to give you the opportunity to respond.
NABCEL, the bridge project, transforming Nuneaton. Absolutely no, we're not allowed to see any of where that money goes. £469 NABCEL charge. Yeah? This borough, this council, for one room with shared facilities in pretty shady places to live. Yeah? I have the paperwork that was signed by someone in here, yeah, and sent out. Yeah? So that's NABCEL, yeah, charging the borough that, and someone in the council signing it off. P3. And the threats that people get in this accommodation, if they make any complaints, the threats of eviction, we've had evictions, we've had court cases, yeah? Even court cases against members of this chamber, which you refuse to hear, yeah?
I'm going to allow Councillor Golby to respond, because this may become a legal issue, Mr. Smith, so you need to be very careful what you're saying now, and that is my advice to you. Councillor Golby.
Can I just say that, how do I put this politely? The gentleman is passing off fantasy as objective truth, and I think we need to be aware of that. I don't know whether to feel sorry for him about the level of delusion that he's clearly under, or whether to actually take further steps legally. But what is clear is that it is fantasy being passed off as objective truth, and that is the politest way I can put this. However, I think it's probably about time that we did have some kind of meat on the bones of this, because you rile off project names and other names, and P3 is not a member of this council. P3 is actually an independent charity commissioned by Warwickshire County Council, nothing to do with this council. NABCEL, everything is publicly available as far as the charges are concerned, the recharges to the council, both on our side, and there are submissions made to Companies House, because it is actually a legitimate legal entity in its own right. It was set up years ago, not by me, because I've been accused of setting it up, not by me. It was done years ago, and if it, honestly, can we just? I think we just need to. Everybody needs to be aware that this is fantasy being passed off as objective truth.
And obviously, again, because an allegation of corruption was made against Councillor Gutteridge, I'm going to allow Councillor Gutteridge to respond.
Thank you, Chair. Mr. Smith, are you saying I'm corrupt? Is that a yes or a no? Can you use the microphone?
Can you just confirm that on the record, on the microphone, please, Mr. Smith?
Yes.
Councillor Gutteridge.
In what way, Mr. Smith, am I corrupt?
Can you do that on the microphone?
Financial dealings of this council need looking into. Yeah? NABCEL, all of it. Just bring up, just show us all. Show us all you're not corrupt. Because at the moment, we can't see any evidence of where our money's going. And there's a lot of money coming in here. Yeah, a lot of money. Just bring it all out. Put it in the open. Not pages and pages of words of why you don't have to tell us stuff. Just bring the books in and let us have a look at them.
So let's just refresh. You're saying I'm corrupt. Is that correct?
I'm saying this council's corrupt. If you're part of it, right? If you're part of this council, you're part of NABCEL, whatever. Yeah? Look, don't play games with me either. Yeah? If you want to start legal action, by all means do. Just bring NABCEL's financial dealings in here and let us have a look. You could prove me wrong completely. All you have to do is open up the accounts of this council.
To confirm, Mr. Smith, when Councillor Gutteridge previously asked, were you accusing him of corruption, you replied yes. No, you replied very specifically yes. But I think that's enough is said. Coming back to the report, I've gone through the report. If anything, it actually strengthens the scrutiny function of this council. So I don't see what the issue is. So I'm going to propose that the report, the updated guide, be recommended to council for approval. Does that receive a seconder? Councillor Kenner is seconding that. Does any member wish to speak on the item itself? Councillor Cape.
I actually welcome the paper because being, or the policy, sorry, because being newly elected last year, I was a little bit unsure at times exactly what OSP was. I did do training for it, which I had to do, but that document actually now makes crystal clear what it is that we concern ourselves with, which is, are the decisions being made in the appropriate way, and are officers dealing with things in the appropriate way. As to the whole council being corrupt, that includes me, therefore, but at the same time, it also includes every officer on the council, because I have absolutely no financial control or influence whatsoever. For operational levels, all decisions are made by the officers who are held to account legally in many different ways. So I do find it personally a little bit offensive when the phrase "the whole council is corrupt" is thrown about. What exactly is meant by that? Is it the officers? Is it somebody like me who's got no financial control whatsoever? It just becomes a little bit tiresome and confusing.
Thank you, Councillor Cape. Councillor Kenner.
Thank you, Chair. It's just again what was raised earlier on this item. If Mr. Smith would like to see more of the council's finances, in 11 days' time we have a budget where you can come and see how we spend the money. And also, NABCEL is registered on Companies House, so all the finances are publicly listed online, and he's more than welcome to give it a Google and have a look. Thank you, Chair.
And of course, if there was anything of an illegal nature taking place in NABCEL, there is the option of making a formal complaint to Companies House or even HMRC or any organisation like that. And the other point that I was going to make as well is if members of the public want us as a committee to be scrutinising certain parts of the council, they can. You just go onto the council's website, submit a scrutiny suggestion form, and we scrutinise. And indeed, in fact, Mr. Margrave, who is a well-known member of the public, did that some months ago, and it came to this committee, so it can be done. Councillor Shires.
Yes, I just wanted to bring the attention to you, Mr. Smith, to say that we do have a complaints policy within the council with which you can complain about any members, staff, etc. And I think going forward with any allegations, to ensure that it is addressed correctly and efficiently, that actually I would recommend you go through the complaints procedure, because certainly with anything, if you were to then take anything further or consider any action, the first question will always be, have you gone through the formal complaints procedure? And I think that is potentially the best way to do it, because I think one thing I like about the document that we've got is that, and I certainly mentioned to Councillor Evans, this isn't scrutiny at the moment. We've focused in on something that actually isn't within what we've been looking at really tonight. So I think in future, if you do have complaints, whether it's about specific councillors, all of us, please take it through the official complaints procedure, where then we will all be asked to give our information. You will be given the opportunity to have your information, and then a resolve will happen from there. Thank you.
Thank you, Councillor Shires. Okay. Order. Thank you. Are there any further members who wish to speak? No. Okay, then we will move to the recommendation that the guide is recommended for approval to council. All those in favour, please show. That is unanimous. Thank you. We now come to item 12, which is the forward plan. On page 137, does any member wish to speak on the forward plan? No, I see no indication. So we'll go to item 13, which is the committee's work programme on page 145. Does any member wish to speak on that item? Councillor Cape.
I just want to confirm that if I would like a work item to be included, I submit a form through the internet for doing so.
Yes, Maria, can you send the form to Councillor Cape so he's got it on file?
Thanks very much.
Any other member? Don't see any member indicating. So we then go on to item 14, any other items. Councillor Gutteridge, thank you for attending. I think you come from a meeting before this one. Just obviously there was cabinet questions, item number 6 earlier. Were there any questions that members wanted to put to Councillor Gutteridge as a cabinet member? No? Okay, fine. Well, there's no other further items under AOB. So I'd like to declare the meeting closed, and I thank everyone for their attendance. Thank you.